Hello, my name is Valentina Todorovska. I am a national coordinator of the Health Promoting School in Poland. I would like to present the development of this program in Poland. Health education in Poland is a part of the school curriculum. In primary school, the accent is put on pupils' health care, hygiene, rational eating habits, physical activities and prevention. And in secondary school, health education is more focused on life skills. Health education is obligatory in most of the school subjects: biology, physical education, safety education, family life education, social education, and less in other subjects. It is a module in subjects physical education and safety education, and it deals with life skills. Health Promoting School in Poland is defined as a school which, in cooperation with parents and local community, create social and physical settings that improve health and well-being of all members of school community and to improve their health promotion competencies. The main key health documents in Poland are: there is a formal agreement between the education, health and sports sectors concerning the main directions of activities, responsibilities and forms of health promotion and prevention. We have a national health program and dissemination of the health promoting school concept in Poland in it. Also, we have a regulation of the Ministry of Health that concern products offered in school shops. Now during a pandemic they are closed, and requirements that need to be met in school canteens that offer lunch for children. Health Promoting School in Poland started in 1992 and it has been maintained for almost 30 years, among other things due to good structure, which is built in a cascade way. We have a national, central level, regional level, local level, and school and kindergarten level. On the central level, the leading institution is Center for Education Development, which is an in-service teacher training center. Poland has 16 regions, and in each of them we have regional coordinators. They work in in-service teacher training centers, regional offices of education authority. We have local levels as well. They are sub-networks in the frame of regional networks. And we have school level and kindergarten level, more than 3,200 schools of different types, including kindergartens with primary schools dominant in our network. Here we have a health promoting school model in Poland. It has a shape of a house. On the base there is a first standard, conditions for development of health promoting schools, and in it health promotion in school documents and good structure and organization for health activities. Main fields of activity are in the next standards: social climate in school as a second standard. Third standard, connection between health education and school education and prevention plan, and here we assess active participation of students in health education, collaboration with parents, and health education for teachers and non-teaching staff. In the fourth standard, we assess school conditions and organization of leading process and working, assessment of school facilities, clean school, breaks between lessons, physical activity of all members, and healthy eating. And in the roof, we have expected health outcomes. We evaluate well-being of all school members and activities that school members take for improving health outside after the school hours. Each school in our network, in the beginning of a school year, carry out a diagnosis and choose a health problem, health need, issue to be solved during the school year. Schools carry out evaluation using different tools and techniques, for example, observation, documentation analysis, interviews, questionnaires, draw and write research techniques for 3rd grade, writing how do I feel at school, 5th grade, and draw and tell research technique for kindergarten, for children 5-6 years old. What are the main successes of health promoting school in Poland? Identification of needs of all school members, not just pupils. Long-term activities, a leading theme for each school year. Planning and evaluation of school tasks related to health. Continuity in health education messages at home and in local community. Good relationship with parents and communities to solve school problems, and active participation of pupils in health education activities. Written criteria for membership in our networks, model and national standards, developed indicators and assessment tools for evaluation. We provide trainings, summer school supervisions, conferences, now online courses as well. We disseminate manuals and other materials for our coordinators and also SHE materials. Also, we have a procedure of establishing the Health Promoting School National Certificate honored by the Ministry of National Education. Here are our manuals. At the left, there is a manual for primary and secondary schools. In the middle, manual for kindergarten. And on the right, the newest one, manual for special schools. What are our difficulties and barriers? The local networks show different levels of activity in the area of health promoting school. And it is very difficult if the key person coordinator is a coordinator for a short time. Also, the problem is a lack of financial resources. And in this case, it is very important to find a motivation to support regional coordinator and also school and kindergarten coordinators. And in the end, some words about COVID-19, a challenge for all of us and for Polish schools as well. The barriers are lack of access to the internet, especially in certain rural settings. Some teachers with no essential basic competencies in online distance teaching and in using digital tools. Lack of suitable conditions for learning, housing conditions. Parents have to combine professional and parental responsibilities. Necessity to share the equipment at home among family members without camera, printer, and so on. Problem of equipment also affects teacher. Problem with students who have a addiction of smartphone and internet. And also no prepared tools, barriers for students with special education needs. What is important for each school is to diagnose the level of exclusion and to define the barriers of the online education. My institution as a teachers training center organizes webinars and teleconferences for teachers, disseminate materials concerning mental health of pupils, positive school climate, relations and cooperation during distance learning. What does it look the situation in Polish schools now? Schools are open for classes from 1 to 3 and from classes from 4 to 8 are closed, and secondary schools also are closed and lessons are held online. There is increased hygiene in schools, cleaning and disinfection of premises and surfaces. The arrival of persons from outside the school is minimized. It is compulsory to keep a distance between pupils in the common spaces, on corridors, in changing room and so on. One class is assigned to one permanent classrooms. Measuring the body temperature of workers at the entrance of the school. School trips are completely banned. Swimming pool as well. Physical education classes are organized in the open space. In the case of pupils with healthy problems, parents should be informed of the possibility of staying at home. What are the main priorities? Students' well-being, relationships, and development of interests and competencies. Thank you for your attention.